In this video we see how the shoulder joint is, how the hip joint is formed. So this is the articulating head of the femur. This is the neck of the femur, and this is the greater trochanter of femur, and this is the lesser trochanter, and it is the intertrochanteric line which is defines the posterior surface of the femur, and this is the shaft of femur. It is one of the long bone, and here you can see this is of because of true bone. You can also appreciate here the margins of so these are the margins. These show the characteristic spongy cells of spongy bone structure, cancellous bone. These are the bone marrow have here the bone marrow is production is take place here. These are the two condyles of the bone. So the medial one is on this slight angulated, and this is the lateral condyle. It is the intercondylar fossa, and now here it is the supracondylar fossa. There is a most prominent structure on the posterior aspect of the hip bone. Sorry, my mistake. Of the femur, which is called linea alba, which provides the traction, which provides the counter traction for its curvature along the anterior surface. So it resists the bending moment of the femur. Here is the you can appreciate the markings very well. It is of this rugosity is of because of the attachment of gluteus maximus muscle along the posterior surface of the femur, and here in this greater lesser trochanter we attach the muscle iliopsoas muscle, which is the major flexor of the hip joint, and the it on this is the fossa. This is the superior. On this side attach the piriformis muscle, and this is the greater trochanter. When the femur ossifies, it contains three ossification center, one of the greater trochanter, lesser trochanter on the neck of femur, and this is the head of femur. The smooth surface marks the articular surface of the femur, because it contains almost to half of the circle inside the hip bone. So it is one of the stable joints of the body and of a ball and socket joint type, which provides greater range of motion. And on the inner side you can see this is the fossa centralis, so fovea, which supplies the head of femur, which supplies the blood to the head of femur. And now to identify the side of the femur, we can also say that always femur head is on the uh, lateral side, and the condyles, smooth condyles, or the curvature is of the outerwards, or you can also say by the lateral medial condyles, or you can simply hold the neck of femur by your first web space and held it in this position. So if you can hold in this position, so it is of right hand side. If you can hold this so you can show this is a right hand side femur. It is one of the longest bone, and on the upper side is from the hip joint, and the lower side it's on the knee joint. Thank you.